Hi everyone and welcome in my channel. My name is Shaer. I am pharmacist and bipolar in the same time. Yes, I am proud to be bipolar and I am proud to see it here in front of you. Today I'm gonna talk about one of the most important antidepressant worldwide. It's called Cipralex and in some countries called Lexapro. I will talk about its chemical characters, uses, side effects, how to minimize side effects, drug-drug interaction, its mechanism of action, and I gonna ask the most frequent asking questions. Yes, let's go. Cipralex or Lexapro in some countries. In some countries called Lexapro, like in USA, Lexapro, okay? Both of them are the same brand for the same pharmaceutical medical company, which called after Lundbeck, okay? Its active ingredient called escitalopram, okay? Concentration, it usually comes in two concentrations, 10 milligram and 20 milligram, okay? But here in Egypt there is a unique concentrations 5 milligram as syrup, okay? To have the time after which you have to take the second dose is 24 hours. What about forms? Usually in film coated tablets. What I mean by film coated tablets, not affecting by meals, okay? You could take it before meals or after meals, no problem, not harmful for stomach. And in some countries, like here, like in Egypt, it's available also in form of serum. It's called zigarot, which contain escitalopram 5 milligram. Okay. Metabolism. It already metabolized in liver by CYP enzymes. Mainly two CYP enzymes. Number one, CYP 3A4. Number two, 2C190. 2C190. Okay? Excretion completely excreted in the urine. Okay? What about alternatives? Alternatives? Here in Egypt market, in Saudi market, and the most famous alternatives worldwide. In Egyptian market, there are a lot of alternatives for Cipralex, but the most famous, Ciprapro, escitalopram. Escitalopram here as generic name, not chemical name, okay? In Saudi market, there are 3 types of alternatives, only 3. Cipralex and Entapro and Zilax, okay? Worldwide, there are a lot of alternatives worldwide, but I gathered for you the most famous for them, okay? For example, Debralin, Lexa, Muzarin, Isitara, Elicia, Nexapram, Barametis, Mitacida, okay? If you are from any country in the world, just write down in comments and I gonna tell you the most common alternatives in your country, okay? Just write down in comments. Okay, let's go to mechanism. Its mechanism of action. It acts by a mechanism of action called selective serotonin reuptake inhibitors. SSRIs. Could you, doctor, tell me how it acts by this mechanism? Okay. This mechanism, I wanna to simplify it for you. Okay? Just imagine with me. Yes, this one is a pre-synapse. This one is post-synapse. This one is synaptic cleft. Between them, synaptic cleft. Here, in the pre-synapse, serotonin is sensitized from amino acids. Okay? After that, it is excreted to the synaptic cleft here. Okay? Between synapses. But it go back again. Usually go back again. It goes back again to the pre-synapse here, okay? And it breaks down. After going back, it is breaking down. You get it? Selective serotonin reuptake inhibitors medications comes here and make blocking for receptors and prevent serotonin to go back again to the pre-synapse. Let's say it on photo. Here is the pre-synapse. This one is the post-synapse. Okay? This area is synaptic cleft. Serotonin is sensitized here. After that, it is excreted from here to be in the synaptic cleft, to be collected in the synaptic cleft. But it comes back again to be breaking down here in the pre-synapse. Selective serotonin reuptake inhibitors comes here and make blocking for this area, for these receptors. Okay, you get it? I hope this is helpful. I tried to simplify it. Okay. What about its uses? Mainly, it's used for depressions, all type of depression. First degree depression, acute depression, and major depressive disorder. Also used for anxiety. Anxiety is characterized by nervousness. Okay. OCD, obsessive compulsive disorder, and panic attack. Okay, 4 uses: depression, anxiety, OCD, and panic attack. What about side effects, doctor? Okay, on CNS, it causes sedation and drowsiness. The most common side effects: sedation and drowsiness. On GIT, it causes nausea and vomiting. On weight, it increases appetite and also increases weight. What about sexual dysfunction? It causes low libido and increased time for ejaculation. Okay. How to minimize, doctor, these side effects? Could you tell us about minimizing side effects without drug-drug interaction or without quitting medication? Okay. To minimize side effects like sedation or drowsiness, you have to take it before sleeping by 1 hour or 2 hours. You have to avoid driving after using it. Okay? What about GIT? Problems like nausea and vomiting. Usually I advise, if you are suffering from nausea and vomiting, to take organic apple cider vinegar daily before meals. It's really amazing for this. For these side effects. Okay, if it is not okay with you, you have to take some OTC medications like metoclopramide, domperidone, to avoid nausea and vomiting or to minimize them. Okay, what about weight? Appetite increases appetite and increase weight also. The best solution for appetite from my point of view is to make intermittent fasting and keto. Both keto and intermittent fasting together, or intermittent fasting alone or keto alone. You have to do them. Or doing any exercise. Okay? Or you're doing any exercise. There are a lot of supplements which are safe, completely safe to use it with antidepressant medications like Garcinia Cambogia. I gonna make comprehensive video about them here, inshallah, in the future. What about libido? If you are suffering from libido, there are testosterone boosters. Here in Egypt, Covagen is amazing food supplements for testosterone boosting, and for females, Afrofem. In Saudi market, Gentaplex, and there are a lot of others completely safe testosterone boosters supplements. Okay. What about drug-drug interactions? For drug-drug interactions, the most common with MAO inhibitors, with lithium, with tramadol, with clopidogrel, and with warfarin. Okay, let's go to the last part in this video. The last part, the most frequent asking questions. Doctor, question number 1. What about its withdrawal syndrome? To avoid withdrawal syndrome from any medical substance, especially citalopram, you have to stop it gradually, monthly, under supervision of your psychiatrist. Okay. Doctor, what about I use it only for delaying ejaculations? Really, it is not approved by Food and Drug Administration for delaying ejaculation. It is approved for depression, anxiety, OCD, and panic attack, as we mentioned before. If you want something specially approved for delaying ejaculations, any medication contain active ingredient called daboxetine. Okay, this is the only approved tablet for delaying ejaculation. You could use another methods like local anesthetics, lidocaine and prelocaine. Okay. Question number 3. What about using it in spastic colon? It is not recommended by FDA in spastic colon. Okay, not recommended at all. It is recommended for treatment of depression and anxiety, OCD, and panic attack, as we mentioned before. Okay, not for spastic colon. If any physician write it down for spastic colon, it is not official. It is illegal. Okay. Can I use it for increasing weight? Really, some persons using it for increasing weight, but this thing is not okay. Okay, because it may alter the chemical substance in the brain, especially serotonin, and this on long term may be cause a lot of side effects. Okay, we have to use something not cause side effects for weight gaining, like zinc, like BCAA, whey protein, amino acids, doing exercise, weightlifting, any other method. But we have to avoid any CNS medications for weight gaining. Okay? Can I have an occasional drink while on Lexapro? From my point of view, it is completely forbidden. Why? Could you tell us, doctor, why? Okay, because it, as we mentioned, it is metabolized by cytochrome P enzyme in the liver. Using any drink with Lexapro or Cipralex could be toxic in liver enzymes, could make liver toxicity, hepatotoxicity. So my point of view, you have to avoid using any occasional drink with it. Okay. While I have to take it forever. Really, it depends from one to another. Okay. Does my brain go back to normal after antidepressant? I guarantee this for you. I am already on CNS medications for 5 successive years, and I have quit them since 7 years right now, and I'm okay, as you see. Okay, everything gonna be okay, inshallah. The last question is 10 milligrams Cipralex enough for anxiety? Really, it differs from one to another. It depends from one to another. Could be enough, and some persons couldn't be enough. So it depends. Okay, that's it for today. If you have any questions, just write down in comments, and see you next video. Bye bye.